So it was an exciting presidential session, in my opinion. So in the late-breaking abstract number 1, that I had the privilege to discuss, have been presented the first data of immunotherapy in triple-negative breast cancer. There is an outstanding improvement in overall survival in the PD-L1 population, with 25 months in the population receiving the immunocheckpoint versus 14 months in the population with chemotherapy alone. The final message of that presentation is that we need to select patients with triple-negative breast cancer who are more likely responsive to immunotherapy. So not only PD-L1 maybe, but also BRCA mutated or patients with tumor-infiltrating lymphocytes. The second presentation was related to the SOLAR-1. It is the first precision medicine biomarker-driven trial in which patients with PI3 kinase mutational status activated have been randomized to receive endocrine therapy with fulvestrant plus or minus alpelisib, that is an alpha-selective PI3 kinase inhibitor. I believe the data are quite interesting because we have an improvement in progression-free survival 10 months versus 4 months, and it's quite outstanding in my opinion. I know very well this agent can be managed, the toxicity, and we need also to define the roadmap for ER-positive disease, because following a progression to CDK4/6 inhibitors, what we have to do, maybe if you have a PI3 kinase mutation, you can propose alpelisib. And finally, we have the PALOMA-3. It's impressive to see overall survival data in the metastatic setting in ER-positive disease. The most tricky data that Massimo Cristofanilli presented are related to the type of population that got major benefit, and this is the so-called endocrine sensitive population. So in the context of patients progressing to endocrine therapy, we have some patients that have a time to treatment failure that is longer, that derived more benefit from the addition of palbociclib. So in my opinion, the 3 presentations are practice changing. We need to elaborate the data. We need to better understand what to do in our patients tomorrow morning. But my personal opinion is that that was an outstanding presidential session. So the last presentation of the presidential session was about an HDAC inhibitor. Many trials have been designed with HDAC inhibitors. I just remember the one with entinostat. But in this meeting we have the first data with chinomide, that is an HDAC inhibitor developed in China, that is an emerging world, and finally approved also in China. The trial was designed for patients with endocrine-resistant disease that have been randomized to exemestane plus chinomide versus endocrine therapy alone, and there is an improvement in terms of progression-free survival. I believe HDAC pathway is a very interesting pathway, should be explored also in other subset of disease, maybe in combination with immunotherapy. Data here presented clearly demonstrate that manipulating ER-positive disease with an histone deacetylase inhibitor can really improve response rate and progression-free survival in ER-positive metastatic breast cancer patients.